Hydroxyzine is a medication classified as an antihistamine that also reduces anxiety. It is non-addictive, works quickly, and is great for situational anxiety and sleep difficulty. Propranolol is a beta blocker that blocks the physical symptoms of anxiety, racing heart, trembling, sweating. It's perfect for performance anxiety such as public speaking, presentations, and social situations. It doesn't treat the mental anxiety, but it stops your body from spiraling. In addition to medications, there are also other advanced interventions for anxiety. So let's talk about some of them. Transcranial magnetic stimulation, or TMS, is FDA approved for depression, not anxiety. However, we often see anxiety symptoms improve as depression improves during the course of TMS. TMS works differently from medications by using targeted magnetic pulses to stimulate underactive areas of the brain involved in mood regulation, especially in the prefrontal cortex. As mood stabilizes and brain networks become more balanced, many patients notice less anxiety, fewer intrusive thoughts, and an improved ability to cope with stress, even though anxiety is not the primary indication. You also need to know about esketamine, also called Spravato. This is FDA approved for treatment-resistant depression, not anxiety. That said, in clinical practice, we often see that as depression lifts, anxiety symptoms improve as well. Esketamine works very differently from traditional antidepressants like SSRIs or SNRIs. Instead of primarily targeting serotonin, it acts on the brain's glutamate system, specifically NMDA receptors. It works fast for many patients, and some feel much better just hours or days after the first dose. Another very exciting development in anxiety treatment is psychedelics. Psilocybin and MDMA are showing remarkable results in clinical trials for anxiety, depression, and PTSD. These aren't mainstream yet, but they're coming. Here's the truth. There's no one-size-fits-all treatment for anxiety. What works for Alex might not work for you. That's why we use a personalized approach. We look at your biomarkers, inflammation, nutrient levels, hormone status, your life context, stress load, sleep quality, support system, your genetics, how your genes affect the way your body responds to medications, your treatment history, what's worked, what hasn't, and we'll build a plan that's yours. Here's the mistake I see over and over. People treat symptoms, not systems. They take a medication but ignore sleep. They try therapy but consume high amounts of inflammatory foods. They start supplements but never address chronic stress. And then they wonder why nothing works. Your brain isn't broken. It's likely underpowered, undernourished, and overworked. Remember Alex, the patient I told you about earlier? We didn't just increase his Lexapro. We ran labs. His vitamin D was critically low. His B12 and RBC magnesium were also low. His thyroid function test showed he was hyperthyroid, so we addressed this in collaboration with his endocrinologist. We optimized his sleep, added vitamin D, started him on magnesium and methylated B vitamins. We taught him breath work and encouraged an anti-inflammatory diet and yoga. And we adjusted his medication down, not up. 6 weeks later, he told me, I feel like myself again. For the first time in years, I'm not just surviving, I'm living, and I'm sleeping better than I have in years. Talking about sleep, if you're experiencing insomnia, I've created a free guide that walks you through the exact steps to optimize your sleep naturally. The link to the free sleep guide is in the description below.